Cassandra Hugill, and I am the Public Engagement Manager at the Department of Imaging Neuroscience, which is in the Queen Square Institute Neurology in UCL down in London. And within the department, we also have two research centres. So one is the Wellcome Centre for Human Neuroimaging, and then we also have the Max Planck UCL Centre for Computational Psychiatry and Aging Research. So just a little bit about the department. So we're based in Queen Square in London, and we have around 100 researchers. We're also home to two research centres, as I mentioned, and we investigate how the human brain generates behaviour, thoughts and feelings, and how to use this knowledge to help patients with neurological and psychiatric disorders. And we predominantly do this through neuroimaging. So we have three key neuroimaging techniques that we do in the department. The first is fMRI. Then we have MEG, which is magnetoencephalography, which kind of looks at the magnetic signals within your brain. And then our new technology is the OPMEG, which is a new helmet technology that basically takes this big MEG hairdryer looking technology and reduces it down to the size of ideally a bike helmet. So this is a new technology that's been developed between our department and University of Nottingham, and I'll actually be coming back to this technology as one of the case studies that I'll present to you today around the work that we've been doing here. So within the engagement team, we have a team of 3 full-time staff. There's myself as the Public Engagement Manager. I also lead on various other projects in equity, diversity, inclusion, including the Inter-Research Programme, which is a programme around social mobility. We also have Joanne Thomas, who's the Public Engagement Coordinator and leads on the delivery of most of our programmes. And then finally, we have Sian Rose, who's the Communications Engagement Officer, supporting in numerous projects, as well as the communication side of the department's outputs. So this is a really long slide. I'm very happy to share this afterwards or give you a link. But basically, our vision is to embed meaningful and valued public engagement into the research that we do. And our mission is to show that the impact and value of public engagement can have within the research as a tool for maximizing research success. So this is something that I was really passionate about when I started in the department 5 years ago, and it was just myself as a public engagement coordinator. But I really wanted to help researchers understand that public engagement doesn't have to be something that's done off the side of a desk. It doesn't have to be something that feels like a big amount of effort and task with no benefit, and that it can actually really enhance and improve research outcomes. So our aims are to foster a culture where public engagement is valued by all staff, and it produces world-leading researchers with the experience and drive to readily engage with diverse communities. So we wanted to be a bit of an incubator for researchers that will then go on to new jobs and new career pathways and utilize the tools that they learn here to continue to engage with different public groups. Our second aim was to run a high quality and impactful engagement program that is embedded into the research. So not something that's on the side again, something that's really intrinsic to the way that research is done. And we felt that this was really, really important to see that value. Third, we wanted to build a network of community partnerships focused on supporting and engaging people with neurological and psychiatric conditions. And you'll see from the case studies that we work with a number of different organizations and charities. In fact, we have over 35 partnerships with different organizations. And this ranges from international charities such as the International OCD Foundation, the World Health Organization, through to more local charities such as Parkinson's UK, and even small grown charities. The reason that we do this is that we strongly feel that trying to find and access those communities ourselves would not be cost or time effective. It's really important that we have these charity partnerships so that we can access these communities and that we have that charity knowledge on how best to engage with them. And it really has led to fantastic successes. And finally, from all of this, we want to develop effective tools to reach groups not currently engaged through traditional methods. So we know that public engagement typically engages with white middle-class people. And we wanted to change that. We wanted to really diversify the groups that we're working with and make sure that we are thinking around that equity, diversity, and inclusion route as well. So to do this, we really wanted to track what the impact of this strategy would have. So we had an external evaluator, Dr. Charlotte Thorling, come in and run an annual external culture change analysis from 2018 to 2022. And this includes a mixed methods approach with annual surveys going out to the department, in which we got roughly around 80 to 90% response. So I was really, really pleased with that. And interviews with a subset of staff in 2018 at the beginning of the review and to 2022. As you can see on the right there with this graph, the people found that in 2022, people are really supportive of engaging, doing engagement. So 88% reported that they felt they were highly supported in doing public engagement. And then on top of that, something I'm really proud of is that the first time in 2022, there were no respondents who stated that their interests only lay in research. And in direct contrast, there were many who were actively involved in engagement projects they felt were complementary and contributing to their research. So this was a real shift away from in 2018, where we really saw quite a lot of people saying that they didn't really see the value in public engagement. They didn't really understand why people would want to do it. And that it was really a passion-led thing and not really something that would add any benefit to research. So in 2022, we had 50% of respondents saying that they'd taken part in public engagement of some kind over the last 12 months. And about a quarter of those respondents, and then a quarter of the other respondents hadn't ever done public engagement, while another quarter, the remaining quarter, hadn't done engagement in the last 12 months, which means that 75% of respondents had done engagement in some way, with 50% having done it in the last 12 months. Of those not active in engagement, half wanted to be doing more. So we're really proud of those results. And a fantastic quote at the bottom here from one of the researcher respondents was saying that since working at the FIL, we're called the Functional Imaging Laboratory as a pet name. I have learned a bit about the efforts that are being put into public engagement. I have to say that I am pleasantly surprised by it. I did not expect this interest in public engagement from this very academic environment, but I am very happy it is this way, and it seems to be very important work. And this was really nice because this is obviously from someone that has recently joined the department, but they already felt that there was a strong culture for engagement. So how do we do this? Well, I take a design problem-centric approach. So what I do when I initially engage with an academic and think about a project that they might want to do, I ask them to think about the types of problems that they're having within their research. And then I have a discussion with them about these different problems, and we decide on one that we feel that public engagement can really support. So then we brainstorm all the audience types that would help solve this problem. So as a case study, we have a project at the moment where there is a researcher investigating Parkinson's dementia. However, she can't talk to anyone in her patient cohort about Parkinson's dementia because it is so, people really don't want to discuss Parkinson's. And then to add the layer of saying Parkinson's dementia, people completely shut down. It got so bad that people were actually having to remove their, she was actually having to remove Parkinson's dementia from her signature, the Dementia Research Center from her signature. So this was really creating a huge barrier for her to being able to engage with her patients. So we had this problem that we wanted to address. We wanted to work out how can we discuss the risks of dementia within Parkinson's with patients. And then we brainstormed all of the audience types that would help us solve this problem. And I realized that some people might think the obvious one is people with Parkinson's or people with Parkinson's dementia. But it's important that you do this process of thinking all of the different ones, because then we started to go, well, how about those that are helping those people with Parkinson's dementia? How about carers? How about healthcare professionals? What type of healthcare professionals? And this ended up being a really long list. From there, we start to narrow down and identify which specific audience would be best equipped to address the issue. So it becomes this kind of broadening out and then narrowing in. Once we narrow in and identify exactly who that audience is, we come into the next stage, which is thinking about the project itself. So I think most people start at this project idea and then don't really consider what they're trying to achieve or who the audience is. So it's really important that you start at this problem or this challenge that you're trying to do, and then to kind of move your way through these steps. So once we had our audience identified, we started to brainstorm all the different types of events that would both engage the audience and gain the information and input needed to address the problem. So it's this mutually beneficial engagement process that was really important for us to consider. We then kind of narrowed down and identified which event would best meet both audience and researcher needs. And so we actually had a number of audiences that we wanted to address. So we thought about the different ways to engage each of those audience types. For instance, for our patient audience, we knew that we needed to consider accessibility. We knew that having something in person was better for a lot of people. And we knew that we had to include carers in that, because a lot of people go everywhere with their carers once they are diagnosed with Parkinson's dementia. But then on the flip side, we also wanted to engage with some healthcare professionals, particularly clinicians, because we wanted to understand some of the challenges that other clinicians were having as we developed these toolkits. And so from there, we also had to think about healthcare professionals and clinicians in particular, and how time poor they are, and the fact that you wouldn't want to get them in a room because that would be impossible. So we had to think really carefully about the different ways that we engaged with them. So we narrowed down and identified which events would best meet both audience and researcher needs, and also considering such factors as funding, availability of space, availability of tools such as Zoom or Teams or whatever the case may be. And then from this, we developed the project idea. So this is the process that I take all researchers through, whether or not they're doing a small project through our grant scheme that we have internally, or they're doing it for a big grant, such as the Welcome Public Engagement grants that we've applied for. So here's a couple of case studies that I just wanted to take you through to talk about what we've got from this. So the first one is experiencing fatigue. So the problem that the researcher came to me with was that researchers wanted to create a better definition of understanding what fatigue actually is. So within the research community, fatigue is something that is often described as a symptom. However, it can also be a condition in itself. And yet we don't really have a good definition of what fatigue looks like. And fatigue, in this case, we don't mean just feeling tired. In fact, we met many patients who can run 10 kilometers, but can't really brush their teeth, because it's a different process it's a different process. And so fatigue manifests in different ways. So that we needed to consider people with post-stroke fatigue, as this is where the researchers' interests lay, and how they struggle to engage for long periods of time. So we really need to take that into consideration with this project. On top of that, unfortunately, shortly after launching the project, there was a global pandemic. So everything had to shift to be online, which was a huge challenge and a huge pivot that we had to do quite rapidly to be able to meet the timeline of the project. So the project explored the stroke survivors' experiences with post-stroke fatigue through artistic media. And these informed the final artworks and the online showcase called Ensnared, the Inescapable Reality of Fatigue. And this was actually funded through the Wellcome Enrichment Public Engagement Fund, which enabled us to bring in staff and resource and appoint our artistic director to run the project. So over the course of around 8 or 9 months, there was a series of explorative workshops run. As I mentioned, they started in person, but then they had to move online due to the pandemic. So a series of workshops that explored the feeling of fatigue. And these were run by Sophie Layton, who was the artistic director, and Sian Agate, who was the public engagement coordinator on the project. It was really important during this process for Anna Kapaswamy and William Didonka, who were the researchers on the project, to actually be participants and to engage in the creative process alongside the patients. And we found that this really broke down those walls and enabled the researchers and the patients to be able to discuss things openly in a way that they haven't done in a clinical setting. They did various different tasks, including building their own body from clay, which was really interesting because they were bringing together different emotions and different feelings where one side of the body felt bigger and heavier than the other, or started to develop metaphors, and we'll come back to these metaphors shortly as examples that informed the artwork. So some of the metaphors that came from this were really powerful and really showcased the crippling feeling of fatigue and post-stroke fatigue. So we then created artworks that came from this. So a boned corset binding you up and leaving you breathless without movement. An uncomfortable bed offering no rest or relaxation. Uninviting, but you have no choice other than to lie down in it. Tied up in a sheet that you cannot escape. So these artworks really brought emotion and passion to the project that we didn't anticipate. We didn't realize how powerful these artworks would be and how much people would resonate with them. And this really informed the exhibition that was launched in 2020. It really also helped the researchers understand and consider fatigue beyond the clinical setting and provided new perspectives to their understanding and research direction. In fact, Anna, the principal investigator, really did change a lot of the way that she was doing her research, including her testing process based on the conversations and the explorations that were done within this project. The resulting artworks also resonated strongly with the patients, and with several sharing how they use these pieces to help loved ones understand what is happening. So it really was this beautifully mutually beneficial project that enabled the researchers to improve their testing process, improve their research outcomes, but also had a fantastic outcome for the patient community and really helped them feel heard and really resonated with them. Sorry, I'm absolutely racing through this, but the second project that I wanted to talk about today was the OPM Collaboration. So again, we started with a problem. The problem was that researchers wanted to test on young people, so 5 to 8-year-olds with epilepsy, but they were really worried about retention within the scanner. So we needed these young people to stay within the scanner for as long as possible, as the more that they're in it, the more testing that can be done and the better outcomes that can be achieved. But we know that many young people with epilepsy also have other complex needs. So that was a real consideration, and we really wanted to work with young people to understand how we could improve that retention time. On top of that, again, it was a global pandemic, so everything needed to be online. And just to highlight here, we actually worked with Young Epilepsy very closely on this project. And it was a fantastic collaboration in that we, all of the outcomes that came from this project were both embedded within the research done in our department, but also within Young Epilepsy scanning processes. They also have one of these MEG testing facilities that was being built at the time that we were doing this project. So again, we got funding through the Wellcome Enrichment Public Engagement Fund, and we brought in a creative facilitator to achieve these three different aims. So the first one is to have fun, engaging, comfortable helmets to wear whilst being scanned. So we knew that these helmets, which I've just flicked back to, these very scary looking helmets could be quite intimidating and terrifying. So we really wanted to look at how in this design process that they were going through and iterating these scanning helmets, what would be the gold standard that would make these young people feel comfortable wearing these helmets. We also wanted to look at mood balancing and enjoyable activities to do before, during, and after being scanned. While OPM is a fantastic technology that allows people to move within the scanner, they can't move a huge amount. So they can't just walk around the room. They do need to stay within a 1 meter square. And that's quite a lot of, that's quite a big ask of young people. So we really wanted to look at how we can keep them happy and content. We say mood balancing because we don't want them to be too excited that they're just bouncing up around and can't sit still. And how can we make sure that they're really enjoying and engaging with the activities that we provide. And then also, we also wanted to think about that scanning process. So we wanted to develop really good resources that help to explain and demystify the process of being scanned, as it was really clear as we started to talk to young people and parents that it can be a very daunting and scary process, and that the current ways that people were being engaged were not really clear, and it offered a lot of anxiety and ambiguity around the testing process. So working with Chalk Studios, who are actually the company that were already working on the design of the main helmets, we developed these creative toolkits. So the first one was the helmet kit, where they were able to use, if you see down in the bottom here, you'll see that it came as a bookbind type thing, and then they would pop it out to develop their own helmet. They also had customizable sections that they were able to attach to the helmet, and we encouraged them to use dots and things to decorate and to shape these. So as I mentioned, it was during the pandemic, so everything was done online. And we actually worked a lot with teachers who were having to teach online to understand how best to run these workshops and facilitate these with young people. The second one was the task kit. And as I mentioned, they could only be in 1 meter squared. So this is a really nice little kit to set up their space. And then they could bring in different things within their space. So we could look at what they brought into the space that really engaged with them. This was run by Joanne Thomas, the public engagement coordinator in my team, and Heaven Jones, which was an external creative facilitator, really well versed in working with young people. And it was broken down into 3 key stages. So the first was make. There was a challenge within this book that they got, asking them to make something. So it was perhaps maybe to design a helmet, design their helmet and change it and shape it. And then the second one was change. So we added in a variable. So for instance, with the helmet, we added in weight. So they had like a beanbag that they had to put on their head. And then they had to think about, okay, what did they change about their helmet to make it more comfortable? So once you add weight to the thing, maybe they wanted more cushioning inside to make sure it was softer and nicer on their head. And then the third thing is that we asked them to share. So they had to write down what they did, how they changed it, and they also shared it within the online sessions that we had throughout the pandemic. So by breaking it down into these 3 key steps, we found that the young people and the parents really engaged, and the parents were key to this as well, as the parents had their own book to fill out and to share their feedback as well. We also found that the young people were really thoughtful, more than we actually predicted, and that, you know, they were really thinking about other people's experiences, and they didn't just think about their own experiences. So they were really considering what other young people might want, rather than just thinking about their own thoughts and needs. So the outcome of this project was a set of recommendations and insights that have been developed and will be utilised by young epilepsy the research team, and it's also being shared with researchers across the world as the OPM technology is rapidly being developed in multiple countries now. So this report basically presents a gold standard that will help shape the design of these OPM helmets across the world, hopefully, to make sure that they're both accessible and it invites a really great scanning process for the young people. And the principal investigator, Professor Gareth Barnes, on the project, he was a little bit skeptical at first when I first started 5 years ago, but he was saying about how he learned so much from the process, and now they have clear directions both in terms of how we develop the scanning helmets themselves, but also how to make the whole experience of being scanned just more fun and accessible for those young people and their families. So we really saw this as a really great project, and the project report is actually online, so I'll share the link with the slides. So just to wrap up, just some basic facts and figures of taking this approach and why I feel the problem-centric approach has really led to fantastic outcomes. I mentioned about the 75% of the department engaged, but it also has led to really great recognition. So we've had 12 grants awarded over the past 5 years and 2.2 million in funding generated. So this has really brought in great revenue into the department as well in terms of making sure that we have a well-funded team and that we're able to continue the work. Public engagement is now considered a core part of what we do and is highly valued. Senior management see this as a distinguishing feature that sets us apart. And I'm really, really proud of what we've achieved and what we've been able to do. And we're really excited that we've got multiple other projects that I haven't been able to talk to you about today that are continuing to make these changes and these inputs, and more principal investigators are coming to me to co-develop engagement that's already embedded into the grants, their research grants that they're writing, rather than thinking about it later on down the track. So that's a real step change that's happened over the past few years. But what's needed to make this happen is that the public engagement team are instrumental to making it happen and are the main cost for any project. So as I start to consider and write these grants, I always have to consider making sure that the public engagement team are well provisioned. I also have to consider seed funding, as it enables really great projects to be developed before applying for significant funding. So we tend to have a small pot of funding that enables us to run focus groups, to work and form partnerships with charity providers. And it really, I think, sets our grants apart and has led to a really great success rate in terms of our applications. On top of that, I can't say this enough, senior management support. It's really important that senior management see this as not something that is only for PhD students or is nice for the PhD students, and it is something that is intrinsic and part of what we do, and it's valued. It's also important that it needs to be respected and valued as part of a researcher's work and not something that's in addition to the working day. So we often find that people are doing this in their spare time, and that can really have detrimental impact on the culture within the department. So we strongly encourage, and we've really seen a shift over the past few years to people being able to do this public engagement as part of their normal work, which is fantastic. So I'm going to wrap it up there. Thank you so much for having me. There's an email there if you've got any questions, but otherwise I would love some questions. Thank you.